High blood pressure. High blood pressure, we also call that hypertension in medicine, and it turns out to be something that can be fairly bad for your health. We're talking about a situation where people's arteries, the pipes that carry their blood around their body, are narrowed, and the heart's having to work a lot harder to pump the same amount of life-giving blood around the system. So how does this happen? How do we get narrowed arteries and increased blood pressure? Well, it turns out to be a lot to do with our lifestyle. So smoking, poor diet, not enough exercise, not enough sleep, and especially high amounts of stress can harden the arteries and narrow the arteries. All of a sudden, in its simple fluid dynamics 101, you're pumping the same amount of fluid through a much narrower diameter pipe, and your heart has to work much harder. Now, that can be fixed fairly easily. There's two ways, and quite often we'll medicate people, so your doctor will give you some things called statins. They help bring down your blood pressure. Or you can try a combination of that and some lifestyle change, or even best, some simple lifestyle changes. Exercise more, move more, eat better, get some more sleep, and manage your stress, and you'll see some fantastic changes in your blood pressure. How do you tell if you've got high blood pressure? Well, I think most people have been to their doctor and had that cuff put around their arm. They pump it up, and as the cuff deflates, they'll measure two numbers. The first is called the systole, the amount of pressure your heart develops when it's contracting. And the second is called the diastole, and that's the amount of pressure that's left in your system when your heart is not contracting. So 120 over 80 is what's regarded as a really good blood pressure. So that changes, of course, with high blood pressure. And once that top number, the systole, starts to exceed 140, and the bottom number, the diastole, starts to exceed 100, we start to think of high blood pressure. Now, those numbers interact in different and complicated ways, but remember, with blood pressure, the best thing you can do is get out there and change your lifestyle, exercise more, eat better.